I was with the pre-med club for 2 years, and I heard about two types of physicians, John: MDs and DCs, chiropractors. 2 years. One day I was at the library waiting for my lovely girlfriend at the time to get done with some homework, and I found a book on medicine, and there was 4 types listed: MD, DC, DO, and ND, naturopathic doctor. I read about the naturopath and I was fascinated. I loved it because my background is eat right, move as much as you can, lifestyle stuff. And this is these early 80s. And then I read the osteopathic stuff and I literally fell out of my chair. I was like, my goodness, that's a combination of everything an MD does and a DC does and a naturopathic doctor does.
Hi, and welcome to The Balancing Point. I'm Dr. John Nieters, and I'm here to make traditional Chinese medicine, functional medicine, and integrative health simple, practical, and fun, so you can restore balance, boost vitality, and enjoy a healthier life every single day. Hi, it's Dr. John back again with another edition of The Balancing Point, and I really recommend that you stay till the end of this presentation. We'll be on for a few minutes, but today we have Willey, doctor of osteopathy. He's got some great books out there, some fascinating titles, by the way. He's the medical director of the Metabolic Clinic of Ohio, which is located in southeast Idaho. He's board-certified osteopathic physician, did his post-grad training at the Mayo Clinic. Yeah, very impressive. He's a founding diplomat of the American Board of Holistic Medicine and a diplomat with the American Academy of Anti-Aging and Regenerative Medicine, who I'm going to have to go visit, I think, the American Board of Family Medicine and the American Board of Obesity Medicine. So he kind of hits the whole gamut here. Very sought after, so I feel very fortunate to have him today. He's a dynamic speaker, very humble guy, does regular speaking engagements around the country concerning obesity medicine, laboratory medicine, hormone replacement, and other medical and fitness-related topics. Well, on the fitness, looking on Dr. Willey's site, he was a competitive bodybuilder. So he's going to know about the fitness-related topics. He's an established author. He's written a number of books, including internationally popular books. One that kind of scared me a little bit. What Does Your Doctor Look Like Naked? Right? And I came up with my old story about what that title means, but it'll be good to find out the truth. And Your Guide to Optimum Health and Better Than Steroids. He teaches physicians and healthcare providers on multiple procedure and medical topics, including injection therapies, optimal living programs, male and female hormone replacement, peptide therapy, and others. So, listeners, I am sure you realize why I want you to hang around to the end, because I've got some questions for this guy. He also writes for a number of periodicals around the country and multiple medical and fitness websites. And the good news is Dr. Willey is still seeing patients. So that's wonderful. I have many patients who have choices, within different HMOs about who they're going to see. An MD or a DO or et cetera, right? And so why DO? I love osteopaths, by the way.
Sure. Oh, I'd love to tell that story. So in undergrad school, I went to Colorado State University a number of years ago, and I was part of the pre-med club. I was with the pre-med club for 2 years, and I heard about two types of physicians, John: MDs and DCs, chiropractors.
Right.
2 years. One day I was at the library waiting for my lovely girlfriend at the time to get done with some homework, and I found a book on medicine, and there was 4 types listed: MD, DC, DO, and ND, naturopathic doctor.
Right.
I read about the naturopath and I was fascinated. I loved it because my background is eat right, move as much as you can, lifestyle stuff. And this is these early 80s. And then I read the osteopathic stuff and I literally fell out of my chair. I was like, my goodness, that's a combination of everything an MD does and a DC does and a naturopathic doctor does. And so I was actually on a way to a PhD program in Southern Texas in kinesiology, and I read about the osteopathic program because, if I may backtrack a little, one of my experiences in the pre-med club, I got to hang out with doctors. And I hang out with this one doctor, an MD internist, really, really bright guy, wonderful man. And we saw patients all day, and he goes, "Do you have any questions?" I said, "Yeah, doc. You never mentioned diet and exercise to any one of these patients." And he just looked at me and he said, "Well, that doesn't work." Needless to say, John, I no longer went to the meetings in the pre-med club. And so I started down a different path until I literally stumbled on the osteopathic program. At the time, there was just 14 schools in the country, and I applied immediately, got right in, and the rest is history. I just really love the balance, understanding the musculoskeletal system's involvement as a unit and an organ that really helps dictate stuff we now know. Exercise creates something called myokines, muscle chemicals that really dictate almost everything we have. If you look at blue zones across the world where people are living into their hundreds plus, one of the key factors that connects those blue zones is movement, exercise, muscle mass. And I just love that aspect of osteopathic medicine, but I also love understanding Western, as it's understood by Western medicine, disease, and understanding what is available for people from that side, but still being able to use my hands, like osteopathic manipulative therapy. I still do. I do neurotherapy, German acupuncture. I still use that knowledge that I was able to gain about the musculoskeletal system and its anatomy and its relationship to the viscera and somatovisceral reflexes and visceral somatoreflexes and how the gut and the brain work. I mean, we knew nothing in the 80s, early 90s about gut health. If you didn't have diarrhea or constipation, your gut's okay. And we know now, boy, that's not true. That's not true. There's so many things dictated from our guts. So that's kind of a very long answer to your question there, my friend. But that's why I'm very proud to be a DO.
Well, I love it. That was a really, really great answer. And I love that you see things from such a well-rounded perspective. Now, to me, one of the beauties of our conventional medical system is if you have an internist or a cardiologist, they get massive amounts of training. I mean, we're talking
Yeah.
8-10 years, and that's great. But of course, over that time, their vision gets smaller and smaller. Right. And Chinese medicine and what you do, we want the biggest picture possible. Right.
Yes,
We
sir.
want to get the whole person and figure out what's going on there. So I love your
Yes.
approach. Okay.
Thank you.
I can't wait. You got to tell me, what does your doctor look like naked?
Absolutely. Do you have a cover of it right there? I
I
can tell a
don't.
funny story. I don't know if I have one right sitting around here. Anyway, I'll skip on that story. I'll just tell you what that means. What I'm trying to imply in that, what the book kind of hints to is, in summary, what does your doctor look like naked is asking you who your doctor is. And it points out through the book that it's actually you. So we don't mean to create visions of your cardiologist, speaking of such, not wearing any clothes, but who really is your doctor? And that is you. You stand in front of the mirror of your doctor every day. And that's what that title alludes to. What
Well,
does your
that's what
doctor
I
look like
thought.
naked?
I told my wife when I told her I was gonna be interviewing you, and I told her how fascinated I was with that, and she was with a friend out there, and they kinda looked at me like, "What?" I said, "I think what he's saying is going to be, should you be receiving advice from this person? Do they really know about diet? Do they really know about exercise? Or are they just kinda throwing in some theory at you, right?
Yeah.
You want someone who's lived it, right? So,
Yes,
okay,
absolutely.
good, that's what I thought that meant. And then a guide to optimum health and better than are those 2 separate books?
What's your doctor look like naked? The second part of the title is Your Guide to
Oh, I
Optimal
gotcha,
Health.
okay, gotcha.
And then Better Than Steroids, kind of a cult book I wrote. I was a competitive bodybuilder for years, and I still work with a number of IBBFF pros and top level physique artists around the country. And this is back when I really got into it back in the 80s. Steroids were available. You could walk into any pharmacy and get steroids. And doctors from urgent cares were prescribing steroids before the 1987 Steroid Act, which made it a controlled 3 drug. But steroids and performance enhancing drugs were just prevalent everywhere. I used to go into high schools and try to teach the athletes, don't go down this road. Don't go down this road. You're messing with your hormones. You don't know what you're doing. And so better than steroids is just a dietary exercise manual focusing on something called glycogen supercompensation, where you deplete the muscles of glycogen and then you overload them. And that act in and of itself can put 5-6 pounds of muscle on anybody. And so that's where that title came from, understanding how to eat, the correct movement, the correct recovery, the correct supplementation when appropriate is as, if not better than steroids.
Gotcha. Yeah, I remember. So I graduated in 1969 and played 4 sports in high school, 2 of them pretty
Nice.
well, 2 of them poorly. But I was on the 1968 football team. Alameda is a fairly small town, and the high school I went to had a fairly small enrollment, but we were the number 1 team in the state.
Oh,
We
nice.
just rolled over everybody, and now that would never happen again. But when I left at the end of my junior year, I was a starter. When I came back, I got beaten out by this guy who was like a block of granite somehow. I didn't know until 15 years later that he'd been doing steroids. Now he's had tons of health problems since then, right?
Pardon me.
But
Yes.
yeah. So this is back in the 60s, right? So
Oh, yes. Very prevalent back then as well.
yeah. I pulled up a sheet on your newer book, Obtainable. I love the cover.
Well,
It's
thank you.
just fabulous. And so HPA access and the effects of cortisol, hormonal health and balance, gut health and the microbiome, toxins, and oxidative stress. That's a
Yes, sir.
lot of stuff covered there.
Yes, sir. Yes, sir. I call that and I have another book I haven't published yet. It's called Background Check. And basically what that means is your background check consists of those 5 tenets. If those 5 tenets are lined up and doing what they're supposed to do, whatever you're confronted with up front, be it a need for a hip replacement, a motor vehicle accident, a bad diagnosis, you're going to do better when that background has been observed and taken care of. And so those are kind of my 5 tenets of health. When I see a new patient, we delve into particular testing, be it serum testing, be it specialized testing, and help people get those 5 things working, because then they can deal with what is out in front or in the future.
Gotcha. One of the things that fascinated me looking at your website, and my wife is just an avid reader for her whole life, and there are very few medical. She's also an acupuncturist. She's the
Oh,
acupuncturist for the San Francisco 49ers football team. And
wow,
she
neat.
was actually there was a show called The Receivers on Netflix where they followed 5 receivers for different teams leading up to the Super Bowl. And so she didn't tell us. I can't believe she kept the secret, but she was teaching an orthopedics class that weekend, and she had her 2 assistant instructors staying at our house. And it's Saturday night, and I want to go to bed. And she says, "No, let's just watch one more episode of this. Let's just watch one more episode." So, episode 8, toward the end, there's my wife on camera treating one of the most famous players.
Oh,
And you could have
how
probably heard
cool.
us in Idaho, just, just,
That
oh
is
my
so
God,
cool.
that's crazy. Yeah.
Wow.
Um, and when I told her, I went out and I said, "How's your allostatic load?" She goes, "What?"
What?
That's there aren't many words I haven't heard of, but that's one of them. You have
Mhm.
any comments on that?
Yeah, allostatic load is just how all the different stressors that are coming from all sides and how it affects those 5 tenets, how it affects those tenets, how it affects your gut health, your digestion. Allostatic load is just a way to look at how much stress and how much disinformation am I piling on myself or being piled upon, and then what do I do about it?
Mhm.
So yeah, allostatic load's a very detailed. I have a great slide in a presentation I do that kind of it's almost too busy to look at, because it talks about allostatic load and how the environment affects that, how toxins affects that, how lack of sleep affects it, how your food affects it. 73% of our diet is ultra processed. How does that affect it?
Yeah.
Stress. We talk about toxins and we forget about relationships. There can be toxic relationships that are worse than anything I've ever been around or tried to detox people with. So allostatic load incorporates all those different things and how it affects the body, and then flip the slide and say, this is how we treat each of these to help people recover.
Mhm.
In athletics, the term was always under recovery, or excuse me, yeah, or excuse me, overtraining. The term has always been you're overtraining, you're
Mhm.
doing too much. And, having the opportunity to work with professional athletes myself, I had a guy, he's making $20 million a year as a lineman. He can't overtrain. He's got to do his job. So what I retermed it is under recovery.
Uh-huh.
So I don't care how much allostatic load you have on you. If you're not recovering, you're under recovering, you're going to have issues with that. So let's work on recovery. And I've found just empirically over the years that working on those 5 tenets really helps people recover.
Mhm.
And then not only recover, but now they're ready for the next allostatic load they're confronted with.
Thank you. That was a great explanation. It's interesting with athletes, and my wife treats a lot of those $20 million people and more, right? One of the things that I'll be sitting here in my office, and she does a lot of gait analysis, things like that, and I'll
Very
look
important.
up and see this 6'5", 300-pound guy walking by in his gym shorts and nothing else, right? Because it's like, "Whoa, what are you doing in my hallway?"
Oh, that's great.
Yeah, but one of the things I actually was board certified in orthopedics 30 years ago, but I don't do any orthopedics anymore to
Mm,
speak of. I mean, if someone comes in with a sprained ankle, I'll treat them. But she's so much better than I am. I just have her do it, or she's got some other people that work with her. But one of the things I noticed is when I was treating athletes, football players 25 years ago, they didn't know much about their body. Their
no.
diets weren't good for the most part. They partied a little too much, and if I started talking about a certain muscle group, like we need to work on this, they'd give me this blank stare. Those guys know so much about their bodies now. They'll come in
Mhm.
and their diet planning. A lot of them have live-in chefs that are doing,
Uh-huh.
cooking for them, but they know their body. They know their
Mhm.
recovery much better than they did 20 years ago.
Yes,
Yeah.
absolutely agree. Yes, sir. Yeah,
You got
one of my favorite sayings, and forgive me, I cannot think of the guy's name, is medicine is not science. It's empiricism based on a network of blunders. And that has taught me over time that, really experiencing things and seeing it from a clinical aspect like you do
yeah.
is as vital as that double-blinded placebo-controlled study. And if not so, probably more powerful. That's why I love that saying.
Mhm.
And with the internet and with influencers and stuff, people are starting to become a lot more aware of their bodies, as you said, which is great. It makes you and I turn up our game a little,
Oh my god, yeah.
right?
Yeah. My mentor, who I did my first functional medicine class with, 1999, and I got dragged to it, right? One of my friends, I said, I don't need to go do that," and within an hour, it was like, "Oh my god, this fits Chinese medicine like a hand in a glove. We're both
Yes.
after the same thing, and we've got different tools, and if you put them together," and I was just that was it. I was hooked. But
Oh,
again, at
yes.
that point, if you said it was a leaky gut class, that was the title of it. And if you said leaky gut in 1999, doctors would just call you a lunatic, right?
Oh, yeah.
Guts don't leak, right? Well, anyway, so this guy, I saw him a couple years ago at a symposium down south, and I said, "Man, it's tough keeping up with these patients." He said, "Yeah, I'm about 3 months ahead of you, and you're about 6 months ahead of them, and if you ever stop learning, they're just gonna blow right past you." Right?
Yes, that's very good.
I was talking to someone the other day who, of course, we're getting a lot of Chat GPT information and some feedback, like, "I read that this could destroy your liver." Well, once in a million times, it's not good for your liver, but you gotta know the difference between content and context, right? You're
Yeah.
getting content, and then I go through my training and the many, many years of herbal medicine that I've taught. I said, and I've seen 70,000 patients in our clinic, and we've never had a problem. not
Mhm.
one with a side effect, right? And so that's what they get from you is context, right?
Yeah.
You've seen it, you've lived it, you've been it, you've written about it, and you can't replace that. You can't not
No.
replace that at all. And
Nope.
I tell patients the ideal team is a young whippersnapper doctor right out of med school who knows everything new, and the old timer that sits in the back and goes, "Now, wait a minute. Back in '06, I saw a case like this."
Yes. I love that. I love it. Yeah, my preceptor at the Mayo Clinic was a guy who had been practicing medicine for 50, and
Wow.
day one, he sat me down and said, "Warren, I'm going to teach you how to see patients." He says, "Every patient you talk to, if you listen, they're going to tell you the diagnosis. You just have to put a name on it and help them treat it. And help them treat it is what stuck the most
Yeah. Oh
in
my
that
god.
saying." That was just, he's the old guy that, yeah, 50 years by the time I got to Mayo, he had been practicing medicine. So
Wow. That's
that guy
amazing.
knew everything.
Yeah.
It
There's
was
nothing he hasn't
amazing.
seen. I mean, you've got so many medical doctors now that have never seen a case of measles, right?
Yeah. Yep.
And other things like that, or diphtheria, right? And
Yep.
these old timers have seen it all.
Hmm.
Another word that you used, ergogenic. I think that I saw that. I'm probably pronouncing it wrong, so
Oh,
don't
ergogenic.
ergogenic,
Ergogenic.
yeah.
So an ergogenic aid is what I use that in most likely is a performance enhancer, be it an anabolic steroids an ergogenic aid. A vitamin C is an ergogenic aid, something that can enhance performance or function is what that term is implying. So a lot of the stuff we do, peptides are ergogenic aids, hormones are ergogenic aids. To be honest, methamphetamine's an ergogenic aid,
Sure.
right?
Yeah.
So that's what that term implies is optimizing or increasing performance utilizing some sort of other modality besides, I guess even food and exercise could be classified as that. But in general, it's usually a chemical, a vitamin, a mineral, an herb, a substance that improves the performance of either a grand scale performance, like a wide receiver catching a football, or a much smaller performance at the level of the cell that increases mitochondrial oxidative phosphorylation.
Sweet. I love it. Well, I'm gonna steal those terms, so thank you.
Oh, you
Uh,
bet.
the it is interesting you said that about, methamphetamine being one of those agents. There was I think it was the History Channel, but there was a show called Hi Hitler. And of course, it went into Hitler's drug issues. But one of the things they pointed out is with the Blitzkrieg lightning war, is that those guys were all on methamphetamine, right?
I've
And so
heard
they
that.
could stay up for 3 days at a time. But one of the things that pointed out is they completely lost any sense of empathy when they were doing
Yeah.
that. That was amazing. And then the US didn't start catching up, particularly with pilots, until we invented Benzedrine, right?
Mm-hmm.
Yeah, they're dueling drugs, right?
Right. Yes. Wow,
So,
that's a good story.
I know peptides have gotten very, very hot. Now, we don't do injections, so I can't do them. Do you just a question, do you think
Sure.
oral peptides can be valuable? I've heard things on both sides.
Yes, overall, I think there's some that definitely should be injected. But a lot of even the growth hormone releasing hexapeptides like samorelin, which is a very common one, probably the most popular one as a growth hormone agonist, or can be taken orally. One of my favorite peptides of all time, BPC 157, which is the 15 amino acid chain from the gastric acid protein, I think works way better orally than it
Oh,
does
really?
injectable.
Okay.
Yeah.
Yeah,
Especially for
that one's
gut
very
health
popular
related.
now.
Very popular. Good one. Another one called KPV, which is a 3 amino acid peptide, which is a very strong anti-inflammatory. It comes from the melanotan side of the hormone chain, is I think better utilized orally. Some of these, like the GLP-1s, like Ozempic and Wegovy and Mounjaro, tirzepatide, semaglutide, those orally makes me nervous, John, because all of them have what we call permeation enhancers. And basically that means they cause a leaky gut so they can get the drug past the gut barrier.
Oh, wow. Okay.
And
I did not know that.
that is a bother to me. And I actually had a Lilly scientist come out here last week because they have a brand new tirzepatide oral. And she gave me all the data that they were able to make it a small molecule so it doesn't have a permeation enhancer. But the semaglutide version of that, it destroys your gut. And you know better than anyone, you start messing up the gut, you have problems from toenail to hair follicle. It just really dictates everything. So I don't like those. If they're using permeation enhancers to get things across the gut border, I'm not a big fan.
Okay, cool. And male hormone replacement.
Mhm.
What's your do you do testosterone, I'm assuming?
Yep. I have a book called The T Club, which I
The T
wrote in
Club,
2000,
okay.
The T Club, 2008, 2009. I republished it in 2013. That talks about not only TRT, testosterone replacement therapy, but something I call TBT, testosterone boosting therapy. And that really focuses on the type of exercise, the type of food, a few supplements, and even using some gonadotropic stimulants like Clomid, Kisspeptin 10, gonadorelin. So it gives people options. I think if we were to look at a man's 25-year-old's testosterone today versus when you and I were 25, Doc, their testosterone's very low compared to ours at 25.
And ours was less than our parents.
Exactly. Yep. Yeah. Genetic entropy with testosterone levels, that's for sure.
Wow.
But so I do a lot of male evaluations and stuff, but I'm probably, even though I've written the book on it, I lecture all over the country on male hormone replacement, I'm probably the least likely guy to give you testosterone because there's a cause, there's a reason. Something's going on. Unless you had mumps and it destroyed your testicles as a child, or you're on a medication like a calcium channel blocker that's inhibiting the LH testicular access, there's a reason for it. And the number one reason, John, for low T in this world, and I'm going to kind of give you a patient example. I explained to him the axis, the luteinizing hormone from the pituitary goes to the testicles, tells the Leydig cells, give us a testosterone. Testosterone comes back up in a feedback loop, says, here I am. So LH stays happy, testosterone levels are adequate. The number one reason men have low testosterone now, and this is what I tell my patients, I say, your brain can't see your balls because your belly's in the way.
That is brilliant.
It's true. It's this NAFLD, it's insulin resistance, it's your belly's too big. So the best analogy I can come up with, your brain can't see down there because your gut's in the way. So get rid of the gut, and guess what happens? Your T levels go. Whoop.
Yeah, exactly. That's hilarious. That's hilarious. If you do testosterone therapy, what's your preferred method? Injection, cream, pellet?
There's actually 8 delivery systems.
Wow.
For men's testosterone. There's injections, which are probably the most common, most used because of insurance. Insurance tends to cover injections. Pellets are very popular. Now, pellets were first developed in 1939. Under the subcutaneous skin, we put these testosterone pellets, and they look just as they described, look like little pieces of rabbit food, and then they dissolve over 4 to 6 months. So men get steady state levels, comfortable. They're great for people and busy men that travel. There's topical creams and gels, which tends to work better with stuff like erectile dysfunction. You just got to be careful around little kids with that stuff. So I usually don't prescribe that with a young father. There's buccal pads, a little sticker that goes between your teeth and gum. There's troches, which are kind of like dissolvable candy. There's nasal sprays. There's oral. Now there's a brand new oral one called testosterone undecanate. And there's even rectal suppositories. So yeah, the delivery systems are quite advanced and plentiful. We pick the delivery system based on the client, their travel schedule, do they have little kids, et cetera, et cetera. Efficacy for those is very similar across the board.
Okay.
So to answer your question, I really don't have a favorite. I just try to find the best one for my patient.
Awesome. Thank you very much.
Yeah.
That was a brilliant answer. You're essentially a walking encyclopedia.
Oh,
They were invented in
it,
1939, right? It's like, okay.
I'd, the way I've always looked at it, John, and I'm sure you're very much similar, just I can tell by your personality. If I'm going to prescribe something, do something, I'm going to know everything there is to know about it because I want to do what's right for my patient.
Yeah, I was doing an interview. I was being interviewed, and someone said something about Chinese herbal medicine. And I said, well, there's this one fellow, Wang Qingren, and he developed a series of blood stasis remedying treatments, herbal treatments. And in Chinese medicine, blood stasis, right? Thick blood, high viscosity is really at one of the cores of what we want to treat, right? Because it just
Mhm.
causes all kinds of problems. And so then I whipped out his 10 major formulas. Well, if you can't do that, you shouldn't give the formulas, in my opinion, right?
Absolutely, yes. My point exactly, my friend.
Yeah,
If I'm going to, all drugs are poisons and all poisons are drugs. If I'm going to use them, I better know them.
gotcha. So I have one closing question, burning
Yes, sir.
question. Over the last couple months, we've had several patients and even a dog owner report on getting the best treatment they've ever gotten in their life from physicians and or veterinarians from Idaho. What is
Hmm.
it about Idaho? Right?
I
No, seriously, I keep getting this
sure
feedback.
we do. We have like our chief cardiothoracic surgeon here, world renowned, Jacob Della Rosa. We have some of the best neurologists, nephrologists in the world here too. I think it's because there's so much to do outdoors here, John.
Uh-huh.
All of us are avid mountain bikers, avid hikers. I have a little cabin that's 15 minutes out of Yellowstone National Park, an hour from Glacier National Park in Montana. Jackson Hole's 3 hours away. Sun Valley's 2.5 hours away. There's just so much to do. So if you're an outdoorsy person, which a lot of us hippies are,
Right?
that went into medicine, Idaho's the place to be.
Wow. Okay. Well, that's a good explanation because I was just kind of mystified. It's like even one of my staff's sister used to be a dog breeder and so has, years and years of experience with vets. Took her dog to a local vet up there and she said he did an examination and a treatment that's so far beyond, light years beyond anything that she'd ever seen before. And so the staff member, the sister, said, well, maybe we should go open a practice in Idaho. And I said, are you kidding? We'd go broke. They don't need us up there. Right?
Oh,
They
that's
got too
good.
many good people already.
That's great. Yeah, that's why my lovely bride and I raised our family here. There's just so much to do outside,
Gotcha. Okay.
except in January and February. Then there's not much to
Right.
do outside. Yeah.
So anything else you want to add before we call it a day?
No, I sure appreciate meeting you, John. I'd love to stay in touch. And I went on your website and read a lot of stuff about you. I am so impressed. I think I could learn a ton from you. So I appreciate the relationship we've just developed, and I hope we can continue.
Well, I feel exactly the same way. Within about 30 seconds of talking to you pre-show, it's like, oh, this is a guy that I'm going to like. In
Oh, I
fact,
appreciate
Catherine,
that.
who works with me as a co-author on our books, said, oh, you're going to love interviewing this guy.
Oh,
So she was
that's so
right.
sweet.
Well, I want to wish you a wonderful 2026 and beyond. And
You
thank you
too, sir.
so much for being a guest. I really appreciate it.
John, I am so honored. Thank you, my friend, and the best to you and your family.
Thank you. You take care.
Bye-bye now.
Bye-bye. Thank you for joining me on The Balancing Point. If you enjoyed today's episode, please follow the show, share it with a friend, and leave a review. Feeling out of balance? Most approaches just manage symptoms. Here, we get to the root. So real healing, real clarity, and balance can begin. Visit AlamedaAcupuncture.com. That's AlamedaAcupuncture.com to learn more, explore our supplements, or book a call. We'd love to hear from you.